Hi, my name is Roberto Jofra and my partners are Ana Roger and Janelle Garcia. We have done a broad research about carpal tunnel syndrome. What is carpal tunnel syndrome? Carpal tunnel syndrome occurs when the median nerve, which runs from the forearm into the hand, becomes pressed or squeezed at the wrist. The median nerves control sensations to the palm side of the thumb and fingers, although not the little finger, as well as impulses to some small muscles in the hand that allow the fingers and thumb to move. The carpal tunnel, a narrow, rigid pathway of ligament and bones at the base of the hand, houses the median nerves and tendons, sometimes thickening from irritated tendons or other swelling narrows the tunnel and causes the median nerves to be compressed. The result may be pain, weakness, or numbness in the hand and wrist, radiating up the arm. Also, painful sensation may indicate other conditions. Carpal tunnel syndrome is the most common and widely known of the entrapment neuropathies in which the body's peripheral nerves are compressed or traumatized. What are the symptoms of carpal tunnel syndrome? Symptoms usually start gradually, with frequent burning, tingling, or itching, numbness in the palm of the hand and the fingers, especially the thumb and the index and the middle fingers. Some carpal tunnel sufferers say their fingers feel useless and swollen, even though little or no swelling is apparent. The symptoms often first appear in one or both hands during the night. Since many people sleep with flexed wrists, a person with carpal tunnel syndrome may wake up feeling the need to check out the hand or wrist. As symptoms worsen, people might feel tingling during the day. Decreased grip strength may make it difficult to form a fist, grasp small objects, or perform other manual tasks. In chronic or untreated cases, the muscles at the base of the thumb may waste away. Some people are unable to tell between hot and cold by touch. What are the differences and causes of carpal tunnel syndrome? Carpal tunnel syndrome is often the result of a combination of factors that increase pressure on the median nerves and tendons in the carpal tunnel, rather than the problem with the nerve itself. Most likely, the disorder is due to a congenital predisposition. The carpal tunnel is simply smaller in some people than in others. Other contributing factors include trauma or injury to the wrist that cause swelling, such as sprain or fracture, overactivity of glands, rheumatoid arthritis, mechanical problems in the wrist joint, work stress, repeated use of vibrating hand tools, fluid retention during pregnancy or menopause, or the development of a cyst or tumor in the canal. In some cases, no cause can be identified. There is a little clinical data to prove whether repetitive or forceful movement of the hand and wrist during work or leisure activities can cause carpal tunnel syndrome. Repeated motions performed in the course of normal work or other daily activities can result in repetitive motion disorder such as bursitis or tendonitis. Writer's cramp, a condition in which a lack of fine motor skill coordination and ache and pressure in the fingers, wrist, or forearm is brought on by repetitive activity. It's not a symptom of a carpal tunnel syndrome. Who is at risk of developing carpal tunnel syndrome? Women are 3 times more likely than men to develop carpal tunnel syndrome. Perhaps because the carpal tunnel itself may be smaller in women than in men. The dominant hand is usually affected first and produces the most severe pain. Persons with diabetes or other metabolic disorders that directly affect the body's nerves and make them more susceptible to compression are also at high risk. Carpal tunnel syndrome usually occurs only in adults. The risk of developing carpal tunnel syndrome is not confined to people in a single industry or job, but is especially common in those performing assembly line work, manufacturing, sewing, finishing, cleaning, and meat, poultry, or fish packing. In fact, carpal tunnel syndrome is 3 times more common among assemblers than among data entry personnel. A 2001 study by the Mayo Clinic found heavy computer use, up to 7 hours a day, did not increase a person's risk of developing carpal tunnel syndrome. During 1998, an estimated 3 of every 10,000 workers lost time from work because of carpal tunnel syndrome. Half of these workers miss more than 10 days of work. The average lifetime cost of carpal tunnel syndrome, including medical bills and lost time from work, is estimated to be about $30,000 for each injured worker.